Welcome back to EASD TV. We've got a rather noisy studio this afternoon as the Congress continues to be set up. But I wanted to introduce our two guests to you before they get consumed by all the activities of the Congress, because they've got a very important voice in the future of technology, particularly in type 1 diabetes. So let me introduce them to you. We have firstly Simon Heller, who is Professor of Clinical Diabetes at Sheffield Teaching Hospitals in the UK, and Professor Roman Hovorka, who's Professor of Metabolic Technology at Cambridge University. Welcome to both of you. Now, you've both played a very important part in technology associated with type 1. So, Simon, first of all, what's been your interest?
Ever since the mid-80s when I started training, I've been interested in hypoglycemia and its burden in people of all ages with type 1 diabetes. I think that the technology has been absolutely transformational, and Roman has been one of the key figures in that. And there's no doubt that it's improved the outlook for people with diabetes, and that will continue. Although even now, I still think it has some limitations.
Roman?
I think we are living in an unprecedented age where we see once-in-a-lifetime change in the way people with type 1 diabetes are treated. So we are seeing that the technology is really improving lives and outcomes as well of people with type 1 diabetes. I was fortunate enough to be able to contribute to the development of technology, but we are at the stage right now that we're getting these technology to be widely used, and it's another thing which needs to be done right now.
Okay, so let's fast forward you to the end of this decade. What are we going to see, and what would you like to see? Roman, let's start with you.
Yeah. I think by the end of this decade, we will see many, if not most, of people with type 1 diabetes treated with technology, unless we have a cure. I just want to mention it, so people still working with a cure. It will not be for everybody, because people still, the device burden and other things might prevent people using these technologies, but I can see the proliferation of pumps, glucose sensor and closed loop system, which are combining things together to be really the main driving factor which will be widely used to treat people with type 1 diabetes.
Simon?
I think at the moment the hybrid closed loop systems are fantastic for many, not for everybody. It's surprising how many people are a bit resistant. For example, teenagers who don't want to be wearing these kind of technologies, but I'm sure that as the years go by, that will improve. What I think will be really interesting is whether the technology will overcome the deficiencies in insulin, believe it or not, and so-called short-acting insulin, which is the best we have, is still not too short in the way it acts, or in fact wears off to fool the technology, if I can put it like that. But I'm pretty confident that by the end of this decade, we will probably have pumps perhaps using two hormones, not just insulin, which will overcome that. I think the big question for me is not so much the cure, which is probably still 20 or 30 years ago. It's whether we can make these technologies affordable enough to be rolled out, not only in North America, Europe, and Australia, but the other parts of the world.
Yes, because after all, it's a century since the discovery of insulin. Banting particularly wanted it to be something that was affordable to all, and we've still got major issues with the price of insulins all over the world. So, how are we going to overcome this? Do you think the driver will be for technology, or do you think the driver will be more towards, for instance, prevention and cure?
Gosh, I think in type 1 diabetes we will see prevention in children in the next 10, 15 years. It may not be forever, but if it can keep them going till they're adults, then I think their outcomes will be even better. I think what will be much more difficult for me to understand is whether we can bring the price down. There's little doubt, as Roman says, that in Britain we will have these devices available to everybody, and they're probably cost effective. But how long it'll take in developing countries, I just don't know, and I'd be interested. Roman is steeped in the technology compared to me and knows the prices, and I just wonder what he thinks.
Mm-hmm. So probably just going back to the sort of incidence, I think the incidence is slowly creeping up of Type 1 diabetes, so we will have more and more people. So there is some slowing down the progressions of the pre-Type 1 diabetes to diabetes, but I think the numbers are likely to go up, and we still don't know exactly why this is happening. I think we are moving into the stage where these technologies are becoming more affordable. I just want to mention right now there is a nice National Institute of Clinical Excellence assessment of hybrid closed loop in the UK, and it's likely to allow these technologies to be used really widely in the UK, subject to these technologies being cost effective, so I mean the cost level. What I do believe is that as these technology will progress, they'll be used more, and there will be a pressure on the developers to reduce the costs. Similarly, at the same time, it will be producing larger volume of these devices will also lower the cost. So the more you produce, the more cost effective you might have. And it might be in situations where we get to the same level like we have with the strips. Strips were very expensive. Suddenly competition came, and they really went down. And it is possible that the CGM, we will get to the stage that right now they are really prohibitive for many countries. But once you have the competitions, when you have the development, it will go down. I think pumps are a little bit more challenging. And I think the other thing which is challenging is, unlike strips, where you can put them to people and use them, for pumps and closed loop system, you need to have a clinical support and customer support. And it is highly demanding, and is driving the cost as well as part of that. So I think there will be a reduction of the cost, but I think there is a certain level where it's going to be difficult to overcome unless the customer support and everything else is the expectations are lowered down.
I mean, famously, Henry Ford said that for every dollar he reduced in cost of his car, he sold 1,000 more. So, I mean, that's a trend that's, inevitable in technology, that you get lower prices with bigger volumes. But I'm now going to take you to 2035.
Okay.
And say, what do you expect to see? Do you expect to see a miniaturized, personalized technology? What do you see happening?
Well, if I was to be a crystal ball gazer as you were inviting me, I think that cell therapy will have developed in 20, 30 years and probably will be the cure. It's my best guess. I'm not a gambler and I don't make much money on it, but I think that's what will happen, and in between we'll have the ability to prevent or delay type 1 diabetes in young people and adolescents who find it so difficult. That's my prediction.
And what about you?
Yeah, I beg to differ. I just want to give a sort of analogy. When Dexcom, which is the prime developer of the current CGM technology, when they started with long-time implantable sensor for 6 months or 12 months. The problem with these technologies like cell therapy, to demonstrate safety and efficacy, you need to have a long-term trials, and it takes a long time. So I think all these technology might be developing, but the progress of that will be limited by the rigorous assessment of the regulatory bodies. So I think for the time being, we will be probably seeing these sensor glucose measurements going smaller to be more usable, more friendly, more competitive pumps, pet pumps as well. So I think what is interesting in the technology is once you develop a drug, you have a drug for the next 20, 30 years. If you have a technology, every year, in principle, you can improve it. There is always space for improvement. So I think we will see the gradual improvement and changes of new generation of sensor, of pumps, closed-loop algorithms. I'm not sure about the two hormones, as Simon was saying. I think the single hormone is probably to stay with us because of the cost effectiveness. That's my take. But I could see that there will be at some stage, we are at the beginning of avalanche of technology being used widely in type 1 diabetes, and maybe in type 2 as well.
Fascinating. Another great insight for you from two very distinguished contributors. Thank you so much. Stay with us. We'll be back soon.